it's so lovely to have you all join us for this webinar. We've been so excited to have this conversation after our previous webinar because we've had so many questions coming in. So welcome everyone, and thank you for joining our Roundtable live discussion. As I mentioned, this session is a follow-up to our recent Healthy Heart, Sharp Mind pre-recorded webinar that we created for our Red Feb campaign, where we explored with our heart health experts how small, consistent changes around our 4Ms, which are meals, movement, measurement, and mental wellness, can have a huge impact, not just on our heart health, but also on our brain health. If you haven't as yet watched that video, you can find it on our website. We have, as I mentioned, we've had so much amazing feedback from the last video. It's been one of our most popular videos that we put together, which has been incredible. It's great to see people engaging and being receptive with the things that we're putting together. And we've had so many incredible questions that we're really hoping to dive into today with our experts, which is why we brought them all back so that we can try and answer some of these questions. So moving forward, thank you for being here. Joining us today is our public health advocate and Heart Research Australia board member, Julianne Mitchell, cardiologist, Dr. Barin, clinical neuropsychologist, Dr. Miranda, nutritionist Chloe Steele, and exercise physiologist from Kieser, Danisha Ediriwira. Thank you so much for joining everyone, and let's get into the questions. Julianne, did you want to kick off?
Yeah, thanks, Jenny. Well, look, Eddie, as we discussed on our last on-demand webinar, there's a lot of new research now talking about the importance of eating high protein, particularly to protect muscle mass as we age. I wonder if you could talk about, in relation to heart health, how someone managing their high cholesterol levels can include protein in their diet, but not make the wrong choices.
Thanks, Julie. Look, I think it's important to emphasize the importance of a good balanced diet all round. And as you know, meals, or the way you eat, is the second M in our 4M paradigm. And yes, it's important to have protein in the diet in the same way as it's important to have the right sort of nutrients and fiber and carbohydrates, as well as fats. So I think it's very hard to just focus on cholesterol itself. Cholesterol is one factor in several that we have to consider in heart health. On one end, we have evidence, which is a little bit, disconcerting, that cholesterol may not have a direct relationship to heart disease, and yet we have to use it as a direct target for optimizing outcomes after heart disease. So there, the understanding is not about cholesterol, but what cholesterol could become in your body from your diet. Mm-hmm. So I think Chloe hopefully will give us some advice about the best way to manage the fat content of our high protein diet. We just have to maintain a balance across all those factors, not only across the 4Ms, which is movement, meals, monitoring things, and your mental state, but across the sort of diet that you bring in to maintain good brain and heart health. And there's a lot of information, and I'm happy to take more questions on that.
Great. Okay, well, I might change over to you, Chloe, and wonder if you could expand on, how we can increase protein in the diet without increasing animal fats or high cholesterol.
So I'll probably caveat just reiterating what Jenny said. Anything that I do say is general advice. Everybody should speak to their doctor, and whatever their doctor's advice is, you should be following it. I can only give general advice, really. And going back to what Eddie was saying, cholesterol maybe is becoming less important in terms of understanding how it increases our risk for heart disease. And from a meals perspective and from a foods perspective, it's kind of going towards managing the amount of animal fats that we intake in our diet, because animal fats can actually have more of an impact on cholesterol levels in the body than cholesterol-rich foods. So I do have a few top tips that you can follow to ensure that you are getting enough protein in your diet whilst ensuring that the amount of animal fat that you're taking in is kept to a minimum. So firstly, probably one of the most important is looking at lean animal proteins. So opting for, you know, the poultries, chicken and turkey, making sure that it's skinless as much as you possibly can, and also including oily fish like salmon, because these can provide us with good fats, heart-healthy omega-3s. So yeah, that's really important. Now, secondly, what we can do is when you get recommended a protein-rich diet, you can incorporate plant-based proteins. So plant-based proteins, beans, lentils, quinoa, nuts, they're all great options that are high in protein. For people who are on a strictly plant-based diet only, they may find it difficult to eat enough plant-based protein. So plant-based protein, you need quite a high amount in terms of physical amount in order to get enough protein in your body in comparison to meat proteins. You know, you can maybe eat 100-gram chicken breast and get the same amount of protein as what 5 cups of quinoa will give you. So eating 5 cups of quinoa is actually quite difficult. So for people who are on a strictly plant-based protein, I would always maybe consider looking at protein supplement, making sure it's a clean protein supplement as you possibly can. Now, thirdly, I would increase your fiber intake. Now, fiber has actually been shown to bind to fats in the gut and will actually help to remove it from the body before it enters the bloodstream. So foods like oats, beans, fruits, vegetables, they're all great choices. And finally, whenever we do any dietary recommendations, we always pair them with other recommendations. You can't just solely look at the diet. You have to look at your lifestyle as a whole, because the diet is affected by so many different factors. Your body is affected by so many different factors. So when I recommend a high protein diet, I always recommend it with exercise, because physical activity can actually boost something which I'm sure everybody's heard of when you're looking into heart disease, the high density lipoprotein cholesterol, so the good cholesterol. And that can actually help to clear the low density lipoprotein cholesterol from the blood. And so that means that even if you are increasing your protein intake and possibly increasing your animal fat intake slightly more, exercise can actually help to offset any of those potential rises. So basically, in reply to the question, I would say incorporate the lean proteins, fiber, and exercise. And if you do that, you can actually maintain your heart health and meet your body's protein needs at the same time.
Great, great. I think you've given us a recipe for action when we go to the supermarket next.
Yeah,
back to you.
Thanks, as always. We had quite a few questions around managing heart health post having had heart surgery. What are some of the key things patients should be mindful or do after experiencing surgery? This is one that actually a few of you could probably answer, but I'll start with you, Eddie. Yeah, do you have any things that people could be doing post-surgery?
Absolutely. And again, we come back to the 4 M's. When you have a set of recommendations that allow people to follow, I think the framework is really important. Exercise, number one. Keep moving for all the reasons that I hope Danny will clarify for us. Even after bypass surgery, you may not feel up to it, but rehab after surgery or after a stent or after any cardiac event is actually very, very beneficial, and that's based on science. And Chloe, whatever Chloe said about the meals applies after your event as much as before the event. Same things. Watch your diet and follow the recommendations of your clinicians. And of course, after you've been in the doctor's hands, they'll want to measure everything. So the measurement's not an issue. Once you've come across a doctor, they usually record this, and everything else. And I'd be most interested in Miranda's opinions about how to manage the fourth M, which is the mental state. It can be difficult, and a lot of the patients fall into a bit of a slump after their event. And this is quite common and can be a worry, not just for the patient, but for those around him. The obvious explanation would be, oh, it's the trauma of the procedure, it's the uncertainty of it, maybe the fear factor. I'm sure there are many, many elements to it, and I'd love Miranda to expand on that. But before we do, I'll share what I've heard from some of my patients, particularly the high-performing ones. One of the things that leads to mental disruption, so we say, not quite depression or a slump or just a flat attitude, is loss of control. They were, particularly they're high-functioning individuals before the event, all of a sudden, they have no control over what's happened. They're told what to do. They don't know what to do. And it's like being lost in the forest. And that can really have a traumatic impact. So I try to highlight whatever these factors could be for my patients after they've been through, their episode. And I'd love Miranda's thoughts on that.
Yeah. Before we move into Miranda's component on that, I just want to actually, you were talking about cardiac rehab, and I really want to reiterate how incredibly important it is for anyone who's had a heart event or heart surgery to complete cardiac rehab. It's one of the main things we advocate to anyone who's experienced anything with this. And I wanted to chat with Danisha just quickly in terms of the physical recovery from heart surgery and how important cardiac rehabilitation is, and what sort of aspects people should continue incorporating into their routine once cardiac rehab's completed.
Yeah, thanks, Jenny. I mean, cardiac rehab is probably, as Eddie mentioned, one of the most important parts of your rehab process. You got to think of your heart like any other muscle. So if you were having a hip replacement, after that, you're going to go through a rehab process. Your heart is no different. There is a level of trauma that occurs when you have a stent put in or if you have a bypass, and your heart needs to recover like any other muscle, and cardiac rehab is essentially the way we do that. So by, gradually increasing the amount of load on the heart to help build you up back to kind of all those things you were doing prior to your event is a really key aspect. And there's usually stages of cardiac rehab. So, your first stage is more just getting you back into your activities of daily living. And then from there, kind of moving on to things that are a little bit more strenuous or vigorous, that are maybe more long-term goals of yourself, and try to really encourage a change in your lifestyle as well. We all know all the benefits exercise can have. And as Eddie mentioned, even things like the cardiac blues, it's a really helpful way of managing these things. But yeah, cardiac rehab needs to be sort of at the center of your care, particularly just post-event. And it's just there to help you kind of get back to what you were doing prior to your event, and, onto bigger and better things as well. So yeah, a really important part. And that should include predominantly some cardiovascular work, and some might be working with an exercise physiologist at a hospital or in a community practice, trying to build up that cardiac capacity once more. And then also adding in your strength training for more of your activities of daily living again, and really trying to build strength widely so you are a well-rounded individual and able to keep up with life's day-to-day needs and wants. So yeah, a really important part, and a massive part of kind of your recovery post-event.
Yeah. Sorry, just on that, could I also emphasize, rehab is actually a program usually put down as 4 to 6 weeks, but the whole approach should actually be forever.
Yeah.
It shouldn't stop at 6 weeks. Whatever Danny or the rehab team teaches you should be continued, as an ongoing program rather than just a short-term therapy.
Yeah, absolutely. That was my point as well. I think, it helps set you up to move this forward into life and give you those good strategies and those routines as well to just continue that forward. And as you touched on earlier, Eddie, it's the cardiac rehab that they often do in a hospital is actually, it can be really, really helpful for people who have experienced the cardiac blues or that depression, because you are able to connect with people who have been through a similar experience. And we try to support people post cardiac rehab through our Heart Health Club. but it is something that is a real issue and people need to understand more about it. So Miranda, you are the clinical neuropsychologist, the brain guru of the lot of us. In terms of anxiety and depression, as we were saying, they're quite common after a heart attack and they're often referred to as cardiac blues. Are you able to take us a little bit more into why this is so and at what point should people seek help?
Yeah, it's an excellent question. And I think it's important to distinguish between symptoms of anxiety and depression versus an anxiety disorder or a clinical depression. So most people listening today or in future, I'm sure, can look back on life and think of a moment when they've received either a diagnosis or life-changing news. And it's not just in heart disease, but in stroke and cancer. It's very common. It's almost a healthy, normal response for it to very shake your foundations. So to experience some anxiety, some depression type symptoms, often referred to as cardiac blues, is very common after a heart attack or a cardiac event. What we need to be mindful of is when these feelings are not temporary, when they don't resolve, when they get more severe, and when they start impacting on your engagement with rehab. And we've talked about the importance of rehab here. And if people get depression, it's harder to find the motivation to do things. If people get anxious, you often see avoidance behavior. So talking about heart attack, people might, for example, be very hypervigilant to bodily symptoms, and just noticing their heartbeat going, that might trigger anxiety, the fear of having another heart attack. And it can become quite crippling. So if you get that apathy or the lack of motivation from depression or the avoidance and anxiety, and people aren't engaging as well with rehab, that means it's likely their outcome's not going to be as good as if they were engaged, because it's so important. When to seek help? I think you don't wait for depression and anxiety to come on. From day dot, as clinicians, as loved ones, as the person themselves, we need to raise awareness, which is what Heart Research Australia is doing. The whole point of this is raising awareness, and to seek support from day dot, provide support to loved ones, and just being mindful, just keeping an eye out on red flags. If you see people withdrawing, not being as engaged, to ramp it up, speak to the GP, speak to your care provider, your cardiologist, and really take it seriously.
That's really great advice. And, you know, as you said, it is important things people need to be aware of if they have been through a heart event, is to look out for that with loved ones who are maybe experiencing it.
Okay, this is actually a question for all of you, but I might start with you, Eddie. To what extent do genetics influence our heart health?
Oh, this is one of those big topics, but let me explain how I think of genetics. There are actually two components. There's genetics, which is your genes, which you can't change. They were given to you by your parents. And there are four bases. It's a fixed genetic code. Epigenetics is what the body does with those genes, or how it's expressed in that individual. And that's why you can have someone with a certain pattern of genes, but they don't get what's expected up the other end. Think of it like notes on a piano. There are 8 notes on my piano, and the music that comes out depends on how you play the notes. And genetic influences on health is a bit like that. As it happens, what the body does with those notes to create the outcome depends on the 4 M's. Did you know that exercise can alter your epigenetics? Did you know that certain dietary elements can change the sort of the way that your body deals with toxins and inflammation? And again, I'd like to hear from Chloe on that. Mm-hmm. And of course, your mental state. So again, the 4 M's come right back into it. So I tell my patients, genes, 20 to 30%, but what you do and what you do with your 4 M's will alter the other 70%. Mm-hmm. That's how I think of that.
Yeah, that's fantastic. And this is why we love the forums, right? Because everything comes back
Just applies everywhere, doesn't it?
Yeah, if it comes to prevention, it comes to what you do after you've had an event and all sorts of things. But Chloe, epigenetics is actually something you and I personally have spoken a lot about. Do you want to sort of chat about how this works in terms of nutrition? I know, as we've said, this could be an entire webinar completely on its own, but have you got any insights you could add?
Yeah, probably just to touch on what Eddie said. Just because our parents have had heart disease and, you know, our genetics may predispose us to have heart disease, it doesn't mean that we will actually get heart disease. You know, our behaviors, our environment can actually turn on certain genes and similarly can also suppress certain genes. So, yeah, diet can actually have a massive influence on turning genes on and off. So nutrients like folate, B vitamins, antioxidants, all of these things that you get from berries, leafy greens, all of your fresh fruits and veg can actually help to turn on heart protective genes, whilst your processed foods, and I know we've talked about processed foods extensively, Jenny.
Yeah.
The processed foods and certain ingredients that they contain, especially trans fats, they can actually trigger genes associated with inflammation. And I'm sure, as Eddie's probably spoken about before, heart disease is an inflammatory disease. So by turning on those inflammatory genes, we can actually increase our disease risk. So yeah, the diet plays a massive part in our genetics, which can then predispose us or to the development of heart disease. Now, I'd be interested to see what Danisha says about this, because exercise is another massive player with epigenetics, and it's actually been linked to longevity and heart health. You know, even stress and sleep can affect our gene expression as well. So, you know, we can't change our DNA, we can't change our genetics, but we can switch it on and off based on what we do and the environment we live in. So it's really key that we understand that when we're looking at heart disease and, yeah, heart health and living longer, really.
Great, thanks, Chloe. So Miranda, turning to brain health, sorry. We know that genetics can play a role in developing dementia, but how does this compare to the role heart health can play?
I think it's important to just clarify that dementia is an umbrella term. People often use it as a condition, but it's not. It's an overarching term that refers to a whole load of disease processes that all what they have in common is it's a brain disease that causes progressive, so ongoing decline in one or multiple aspects of thinking and memory. So people have probably heard of Alzheimer's disease, vascular dementia, Lewy body dementia. There's loads of different types. And depending on the type, depends on the genetic contribution. Some types in rare cases are what we call autosomal dominant. So if your parents got the condition, you've got 50% chance of getting that faulty gene and developing that dementia. That's rare. And sporadic cases are way more common. And in sporadic cases, there may be some genetic component, but it's not well established, and lifestyle factors have a huge impact there. So I've talked in detail in the webinar that I did in September for Heart Research Australia about the brain-heart links. So if you're interested, it's worthwhile having a listen to that. But in short, maintaining heart health has a direct positive protective impact on your brain health. And loads of evidence has shown a connection between maintaining heart health, being protective against the development of dementia symptoms, things like physical exercise. I mean, we're all kind of there's so much overlap in these 4 M's, and that's the beauty of this, is you do one thing and it has positive impacts around all your systems. But physical exercise is one of the most powerful tools for brain health. We don't think of physical exercise as benefiting brain health, but it's got a huge neuroprotective quality. And in particular, I find really interesting, one of the areas of the brain that's most receptive to physical exercise is the hippocampus, which is a part of the brain that's critical for new learning and memory, and is again the center of Alzheimer's disease pathology. So heart health, especially in sporadic cases, is very, very important. And if you have a diagnosis of dementia, we'd also be talking to you about maintaining heart health to keep keep your brain as healthy as possible.
Great.
Danisha, so while we've been talking a lot about sort of exercise and so on, and we're talking about genetics, do genetics influence our ability to sort of build muscle or the type of exercise that suits us best? And I know I keep sort of saying I'd love to be able to run, but for some reason I don't think my body was built for me to be able to run. Like, is that a genetics thing? And if they do have an impact, how do they sort of impact strength and endurance and sort of our overall fitness preferences?
Well, yeah, as a lot of kind of the rest of the panelists have kind of alluded to, there is an element of your genetic predisposition might, affect you in a certain way, but there's also the ability to influence these things. So, some people may be more prone to being able to put on a bit more muscle more easily versus someone else, or someone might be more cardiovascular fit. That might come down to, things like lung capacity, even like type of muscle fiber and what those fibers are more, or how much of that fiber is more prevalent, which allows them to be maybe more cardiovascularly fit or be able to run further and things of that nature. But it isn't the be all and end all. We have the ability to influence our genetics, and by, training in a particular fashion for a particular goal, we can really kind of adapt to the stimulus that we're providing, and that can help us get to that end goal, if that is increased muscle mass or increased cardiovascular fitness or whatever it might be. So while there is an element that genetics plays, it's not the be all and end all, and it's just something that we need to be able to adapt and speak to an exercise physiologist or physiotherapist around these things and see how you can modify your environment to help get the best and most out of your body as well.
I think I always say that the best thing to do in terms of exercise, it's just something that you enjoy. If you don't enjoy doing it, it's too difficult to maintain. So if there's something that you particularly enjoy, it's much easier to have that as a daily routine or a habit. So
absolutely, all movement's really good movement. So we take what we can get, and if you enjoy it, even better.
Exactly. So coming back to you, Eddie, all of the stuff that we've been saying, as I was saying, the 4 M's are just so interchangeable and you can use them throughout everything. So everything that we've just said about this, is this also similar advice for someone who has sort of comorbid conditions such as diabetes, osteoporosis, or is there anything else that those people should be doing? Or if the genetics conversation we've been talking about is similar, just basically follow the 4 M's?
Yeah, well, look, it's horses for courses as well. And some patients have a better capacity to exercise and others less so. Others struggle with the second M, the meals, and how that lands with them. But again, I'll take you to another set of concepts about how to think about comorbid conditions, because as others have pointed out, a lot of it's got to do with, I've pinned it down to 3 I's, okay? Inflammation is key. You've got to know what inflames you. And a condition like rheumatoid arthritis is very inflammatory. A condition like diabetes is very inflammatory. So once you understand that there'll be that impact on your primary sort of heart health, then it helps you manage that as well. For example, if you had lupus, erythematosus, or one inflammatory condition, look at the sort of foods that will make the inflammation worse. So that's again a 4M concept. That will in turn reduce the inflammation and its effects on your heart health. The second I look at is your immune system. All right, do everything you can to maintain good immunity, because that's what stops you from succumbing to inflammation. But where is your immune system? How do I ramp up my immune system? Well, Danisha will tell you exercise is one great way to bump up your immune system. There are foods which boost your immunity.
I think
Gut
Bob's
health.
actually done a full section on that on our website somewhere.
Perfect.
Yeah.
Everyone should go there. And linked to that is, how the bugs in your gut directly affect your immune system. And I often tell my patients who have palpitations, for example, and I can't find an obvious cause, but the next question I ask is, have you got gut problems? And you wouldn't believe it, 7, 8 times out of 10, they mention they've got irritable bowel or constipation or reflux, or they've had a bad run after a course of antibiotics. It's all directly linked to immunity and inflammation. And that's not even mentioning the brain and what that does to your immune system, okay? So again, 4 M's.
Yeah.
Lastly, I'll mention the third I, which is insulin. And that's totally neglected. It'll be one of Chloe's little sort of areas.
I think we also covered that a little bit later. Yeah.
That's another one. And look, we'll talk about it, but we don't recognize folks who have hyperinsulinemia. We just look at sugar. And I think that's very one-dimensional. I try to spot a lot of my patients with metabolic syndrome, which is pre-diabetes, and the patterns of inflammation that come with that. So that's how I link in other comorbid conditions to the primary problem with the heart. If they've got fans flaming the fire, we've got to put out those fans as well. So in a nutshell, that's how I approach associated conditions. Really important.
Right. Well, look, we have had a lot of questions regarding the role of stress and the impact that high cortisol levels can play. I wonder, Eddie, if you can explain, quite briefly, just what is the role between stress and cortisol on the heart?
Well, if you want to put it down to 2 words, it's actually cortisol and adrenaline. Okay, that's what stress is. I mean, it's not the stress event itself. You can run at somebody with a knife. One will succumb and scream. The other one will just look at you and protect himself. So it's not the episode. It's how the person deals with it. And again, I'd love to hear what Miranda has to say about dealing with that. But what the adrenaline and the cortisol does, it again fans the flames of inflammation and reduced immunity, tachycardia, increased consumption of oxygen for the heart. Adrenaline can stir up arrhythmias. So we have patients complaining of irregular heart rhythms when they're stressed. The blood pressure goes up, and we know about the link between high blood pressure and brain health. That's a very negative association. And I guess what it does to the cells at the genetic and epigenetic level, it changes your body, chronic stress. And that's been well recognized for many years. But one of the problems is, how do you define stress? It's a real problem, and I try to identify hidden stresses in my patients as we talk about their health. And some of them are really truly hidden. It takes several consultations to tease out an issue that they didn't mention on the first visit, and not until the 5th visit does it come out that that's really the problem. And it can be very traumatizing. But then, on the other hand, once you address it, it's almost like an epiphany. They say, well, I can deal with that now. So, that's how I think about stress.
Can I just quickly touch on cortisol from a dietary perspective as well? Because there's a big trend at the moment with fasting, and fasting definitely has its place. There's lots of research out there to back it in terms of DNA renewal and longevity. However, there has been some research that's come out just to say that people who fast might be actually increasing their cortisol levels as well. So for anybody who has got high cortisol levels, I probably wouldn't recommend ever doing a fasting diet. So, like where, you're maybe 5 days a week, you're eating normally, 2 days a week, you're eating very, very minimally. If you do know that you have high cortisol levels, Or, you know, when you've not eaten for a little while and you get irritable, everybody says, oh, my blood sugar's dropped. It might be your blood sugar levels, very, very likely that it is, but also it may be that your cortisol levels are rising, and that is what's causing the irritability. So for people who do know that they are stressed, I wouldn't necessarily always recommend fasting. And yeah, sorry, just wanted to dip in on that one.
Right.
That's okay.
But just on that point, could I ask, Dani, what about exercise when you're stressed? You know, executives who come home from the office at 7 o'clock and then go to the gym for a 1 hour flogging exercise. Is that detrimental, perhaps? Tell me.
Yeah, I mean, there's yes and no is probably the answer to that question. Exercise or physical activity is a stressor on the body, so that has an influence on your stress levels and cortisol as a result. So there are sort of types of exercise that be more predisposed to, you know, increasing that level of cortisol. So if there's really those, you know, super high intensity interval type training things, there is some evidence suggests that can actually increase cortisol levels, but it is probably how long are you doing it for and how regularly you're doing it for. Like if you're doing it on occasion, it's probably not doing you much harm at all. But if it's something that's been prolonged and, you know, backed up on a big, long, stressful day, there is an element where that could have a negative implication. But as a general, if it's done well and you're doing, you know, a variety of different exercises and types of physical activity, as a general, it's going to have a really good impact on your stress levels. It's often a release for many people. It's their sort of peace and quiet, their time to get away. And then also it can have a positive impact on cortisol levels in the long run as well. So it's really about picking and choosing what's best for you and having that variety involved with it as well. Like everything, moderation is kind of the key. So making sure you have that level of moderation as well.
And look, Miranda, I imagine you deal with defining stress every day of your life when you're seeing your clients. So I wonder if you could comment on that and any practical solutions or advice that we haven't already heard of to help people manage their stress symptoms.
Thanks. Yeah, I think Eddie did a really good job of saying some key takeaways that I would be passing on. I think people use the term stress as a thing, but it's actually quite a complex process. You can't just measure it like blood sugar. So you can think of the psychological aspect and the physiological response. So if I said to the audience, everyone listening now, think of something right now that terrifies you. If everyone wrote their answer, there'd probably be some common things like spiders or snakes or heights or intruders. So the really obvious things that we are scared of, fear, stress, that cause stress in us. But I could get two people in a room and show them a spider, and person A thinks automatically, oh my gosh, that spider's going to come and bite me and kill me. And person B loves spiders. They've got pet spiders and they just think, I want to go pat the spider. So person A, that's a psychological appraisal of this object. They've had different responses. So that's the psychological part. Is it a threat to my well-being? And person A is terrified, so has the release of stress hormones, cortisol, adrenaline, fight or flight response, and their stress levels go up. Stress is a healthy response that can be very helpful, but it's meant to come down to baseline. So what Eddie was talking about is it takes a few sessions to work out what people's triggers are, and that's very, very true. We have our things that we're obviously scared of, as I said, but there are the more subtle things, and sometimes this is a difficulty. You might have the obvious, just say you've got your fear of spiders, I'll use that example. You might see, I don't know, like a spider's web, and that starts triggering an anxiety response. And then you might see something else that's loosely related to a spider, and that triggers a stress response. So I use the spider example because it's something we can all relate to, a lot of people can relate to. But if you've had a heart attack, there might be multiple things that trigger a stress response in you that you're not even aware of. It might be hearing a siren in the background. It might be something within your body, like a change in your heart rate or whatever it is. Exertion, if you're walking fast and you start getting a bit breathless, any of that stuff can trigger a stress response. And then the irony is your heart rate increases because you're more stressed. And so it's a bit of a feedback loop. So I think I could say to the audience, you know, meditate, breaks, mindfulness, those well-established things that are known to reduce stress. But on a more individual level, I think it's important for people to spend time getting to know what their triggers are, as Eddie was talking about, and thinking beyond the obvious, the spiders, but really being mindful of what is triggering stress in you. And the second thing, I see a lot of people nowadays, life's very fast paced, and people are almost living so much in their head that they are not in touch with their bodies. And there's a really good book called something like The Body Holds the Score. I've forgotten what it's called, but the body holds onto our stress, and the body tells us when we are stressed. And so often people might have an irritable stomach, restless sleep, they're just feeling a bit run down, and they just dismiss it. But our body is trying to tell us that we're holding on to stress. And if people can just be aware of how stress, chronic stress, can wreak havoc on your body. So it's really important to know your triggers, know what your body's telling you, and then take steps to address that.
Great. Thanks for that, Miranda. Eddie, we've talked a bit about the role of glucose and diabetes, but I wonder if you could just expand a little on, you know, what impact poorly controlled blood sugar levels have on the heart and why it's important to keep the blood sugar in balance.
Well, as it happens, we talked earlier about the impact of fats on the body. One of the nasty combinations is sugar and fats. We know that at a high level that diabetics who are overweight, they do badly in terms of heart outcomes, or they have their heart attacks earlier. The question is why? And I've had to look at this to try to explain to my patients. Firstly, the relative intake of your fats or your bad fats or your processed foods plus your sugar. And I don't want to step on Chloe's territory here, but I understand that when you have a lot of glucose in your system, because you're pre-diabetic or diabetic or just eating a lot of glucose, your liver is very unhappy and starts to lay down fat. And also, the body doesn't manage fats, which includes cholesterol, very well. One of the things that happens is that triglycerides go up, and that's a nasty, nasty fat in the blood. We've been concentrating on cholesterol, but triglycerides is one of the big hallmarks of a bad fat pattern. And it lowers, you know, sugar lowers your HDL. And it also creates a particular type of LDL called small dense LDL. Now think of small dense LDL as pellets of LDL, which get more and more caramelized as it gets exposed to fat. It's on, they used to call it the Maillard reaction. If you put sugar in cooking, you know how it goes brown. That's a chemical reaction. Well, the same thing happens in your body, but at 37 degrees, not at fry pan temperatures. And what happens to that fat is that it becomes very sort of thick and rigid and toxic. And the liver will have none of that. Usually the liver sucks back, its LDL. So the poor small dense LDL floats around because they've been exposed to too much sugar and says, where should I go? It goes to blood vessels, it goes to nerves. And that's why the pattern in diabetics is damage to blood vessels and to nerves. And they go to major organs like the heart and the brain. So sugar is important, but the same amount of sugar coming into the body is handled in different ways by your body. Again, epigenetics. You might have the genes for diabetes, but the way you're not exercising will determine how the sugar gets metabolized, the amount that you're eating, the timing of your eating, the frequency of your eating, for example, snacks. And that's why processed foods are so toxic, because they lay the groundwork for sugar to be super toxic, is the way I see it. And I'd love Chloe's thoughts on what exactly in processed foods, apart from trans fats, which is really very bad for you. I know emulsifiers come into it, but that's how I see the sugar link. Stay away from sugar, particularly fructose, minimize your intake, and be aware of your epigenetics. That will determine how you deal with that intake.
Chloe, just a brief comment.
Yeah, the processed food debate usually sort of surrounds the trans fats, as Eddie said. It will also surround the amount of added sugar that you get in there, but it also will surround the additives, the preservatives that's in there, and also the fillers. So like the guar, like you'll read the ingredients list and you'll see something called guar gum. You kind of go, what is this guar gum? And guar gum is one of those components that just basically gets added to food because it extends the shelf life. It extends it kind of helps the feel in your mouth, because basically when they process food, they take out a lot of the things that we relate in our brain to actually being food. So the feel of it, the look of it, the taste of it, all of that usually gets taken out when you process food, and then they have to add it back in again. So yeah, the guar gums, the trans fats, the additives and the preservatives can all affect blood sugar levels as well. And yeah, basically, like Eddie said, the sugar then will cause your liver to start becoming fatty, and then it can't process any of it can't process any of the bad things that are in your body. I'm not explaining this very well, I don't think, but you know, your liver is
overwhelmed almost.
Yeah, your liver is there to filter your blood. It's there to take any of the bad stuff out of your blood, process it and get rid of it. It's there to detoxify your body. When we have the guar gums, when we have, you know, all of these additives in our foods, your liver becomes fatty because of the sugar that's in there. And then your body cannot process any of those bad additives and take it out of your body and get rid of it. And so it just perpetuates in your body, and your body becomes a very toxic and very inflamed system. And as we know, once you've got that inflammation, that can contribute to heart disease. So in a roundabout way, yes, the sugar that's in it is very bad in processed foods, but it's also all the additives and the preservatives that are in there as well.
Great.
Would it be fair to say that we should be more worried about sugar than cholesterol then?
I would say so, definitely. That's one of my my big things, is that sugar is definitely something that it kind of, we think about it in terms of diabetes. Somebody who's got pre-diabetes or diabetes, we definitely think about the impact that sugar will have. Not necessarily when it comes to heart disease. You know, it's not the first thing that many people get asked about. What's, you know, how much sugar have you got in your diet? And I do definitely think that we should be focusing on looking at sugar as a big contributor to heart disease.
Just on that point, can I then bring in that link again to the brain? I don't know if a lot of people are aware, but they've now called Alzheimer's disease or some forms of dementia diabetes type 3.
Yeah.
And there's a reason for that. It's because we have so much sugar in our diet that the brain becomes so dependent on sugar metabolism for energy that it's forgotten how to use alternative sources of energy, such as fatty acids and maybe proteins. So in a way, you've got to train the brain to come off sugar so that it can learn to use other sources of energy when the time comes. And unfortunately, we're also telling people reduce your fat intake, which makes it low fat, which makes it high sugar. And that itself may be counterproductive. So I highlight that to some of my patients. Just be a little bit careful about this low fat approach. There are lots of good fats, which I think nerves and brains need, and find the foods that give you that.
Yeah, low fats also has a tendency to, when you take out the fat, it also takes out the fat soluble vitamins. So vitamins like vitamin D, you know, just totally get stripped out of the food. And sugar gets added in its place because fat is what holds the flavor. If you add sugar back in, then it gives that, whatever it might be, yogurt, milk, gives it more of that flavor again. So yeah, I'm in total agreement with you that looking at the ingredients list is one of the most important things. If it says low fat, please just check the ingredients, check what they've added in place of the ingredients.
We also have a video for that on our website with you.
Yes.
Miranda, do you just want to make a comment at all about, the role of diabetes on brain health, or any comment there before I go to Danisha?
Not much I can add beyond what Eddie said, aside from the fact that I would agree sugar is so toxic for the body. So
Yeah.
100% in agreement with what these guys have said.
Right. And so, Danisha, if you're pre-diabetic or diabetic, how does regular exercise really help to keep your blood sugars in balance?
I mean, exercise is probably one of the best ways of managing your blood glucose. So when we exercise, no matter what that is, we actually take glucose out of the blood and into the muscle where we want it, so that we can use it for energy, right? So that activity, you can see someone's blood glucose drop if they've got a constant glucose monitor, for example. You can see it drop within that session. So it's a really awesome, effect of exercise in the very immediate present. But beyond that, we also see that post a bout of exercise that it can have beneficial effects on people's blood glucose response up to 72 hours post that bout of exercise, which is really quite amazing. The other thing is, as we increase our muscle mass as well, that allows us more opportunities to get glucose out of the blood and to be stored within our muscles, which is where we want it, where it should be stored, if you will, in the form of glycogen. So by being more active and really making that part of our lifestyle, we're able to get these benefits in the immediate when we're doing the exercise, and then also these long-term benefits where our blood glucose is maintained more across the day as well. And then also might, if done well, you can reduce your need for medications like metformin and others that help with the management of your blood glucose. So there's a multitude of benefits of how it can help manage it, and then also kind of improve your response to, in terms of insulin sensitivity, can improve your, as Chloe and Eddie mentioned before, it can also help with cholesterol, increasing your effective use of HDL to help with the removal of LDL as well. So yeah, pretty multifactorial, but a really key way of helping manage both cholesterol and blood glucose as well.
Great.
That's amazing. Thank you so much, everyone. Every time I get these guys together, I learn so much more, and I could listen to them talk all day. It's just so interesting. But I am very conscious of everybody else's time, so we have gone a lot longer than I had originally planned, but it's just such great content. I feel it's worth it. But thank you so much to all of our amazing panelists who give so much support to us and share your incredible knowledge with not just us, but all of our followers. And it's just so beneficial. And, I really hope people have had some great take homes from that they'll help implement and live a healthier lifestyle. But thank you so much. Thank you, Julianne. Thank you, everyone, for your amazing support. We're so grateful for everything you give us. So I hope everyone enjoyed it as much as I did. And we'll send out the link soon. Thank you.